Hello. We're so thrilled to have you here. And I want to remind all of our viewers that Dr. Copeland is a pediatrician, which is a wonderful, wonderful thing, right? But she's also a board-certified behavior analyst. And that is a pretty remarkable thing. And she's joining us now every third Thursday to have this opportunity to answer questions from our viewers that are specifically for pediatricians, but for a pediatrician who understands the other side of the equation that we're working on, which is ABA and dealing with autism. So, Dr. Copeland, I just couldn't be more excited about you joining us this every third Thursday.
I'm really excited too, Shannon.
Well, we're thrilled. And I want to dive right in with a tough question. We don't want to start with a simple question. So we had a viewer who wrote in and said, question for Dr. Copeland, can you explain phenols, salicylates, and yeast reactions? They seem to be similar, and how do we distinguish? Also, how can we tell if a supplement reaction is due to something working, like a die-off, or incompatibility, for instance, allergies and sensitivities? And they said, thank you. This really is Autism 360, and I agree. We're getting down to it, talking about all these things. Now, some of our viewers may not even have heard the term phenol or salicylate or yeast reaction before. So if you would start there, Dr. Copeland, and talk to us about what all those things are.
Okay, great place to start. So for every one of us, our GI tract contains a variety of bacteria as microorganisms, but also a variety of yeast. Yeast are a type of fungi, and those are part of our natural microbiome. We all have them. And there are some good forms of bacteria, and there's some bad forms of bacteria. The good bacteria do good things for us, like they actually help us produce vitamin K in our intestines, which we need to prevent bleeding disorders. Now, we all have yeast in us and on us, and the most common form of yeast is called Candida albicans. We don't fully know why it's there. But for both the yeast and the bacteria, we know that our digestive systems can get out of balance, and we can either get bacterial overgrowth and or yeast overgrowth, and that can lead to symptoms. A common way to get yeast overgrowth is if a person has had to go on antibiotics for a bacterial infection, say a bad ear infection or strep throat or pneumonia. And then secondarily, this can lead to yeast overgrowth. So there's a theory, a proposal or hypothesis that hasn't been proven yet, but there's a lot of consideration for it, that there is yeast overgrowth common in autism. And one of the things that could happen with the yeast overgrowth is it could damage the intestinal villi, the lining of the intestines. And this could affect how that lining functions and lead to what's called a leaky gut. If there's a leaky gut, potentially harmful substances, including possible breakdown products of the gluten protein in yeast and the casein protein in milk, can get into the bloodstream more readily. And it's hypothesized that harmful products like that then cross the blood-brain barrier and affect the brain. No one has proven for sure that this really goes on in terms of the yeast, but pediatricians have commonly seen evidence of yeast overgrowth, say, in infants and toddlers. It's a common reason for an office visit, that infants may get this thick white film in the mouth called thrush, which is a yeast overgrowth. And they may get some horrible angry red yeast diaper rashes, which have to be treated with an antifungal medication like nystatin or monostat or Lotrimin. So kind of extending that, obviously, if you're uncomfortable with poor gut microbiome, if the balance of bacteria and yeast are in an out of sorts fashion, you may not feel well. Whether that really causes autism or aggravates the behavioral symptoms of autism, there's some evidence for it. It's weak evidence. More research is needed. But if there's leaky gut from, say, yeast overgrowth, and you can go on some special diets, by the way, to not feed the yeast. Yeast loves refined sugar, and yeast loves really starchy diets. And if you look at the standard American diet, there's too much refined sugar and too many starches. So just kicking those out of the diet may help prevent the yeast overgrowth. And if the yeast leads to a leaky gut, that could lead to other food sensitivities. So, and that brings us to the question about what phenols are and what salicylates are. So phenols are a chemical. There's a phenolic chemical ring, and there's oxygen and hydrogen groups attached to that. And they naturally occur in a lot of foods. Salicylates are an actual type of phenol. And if there's leaky gut, or if there's just genetic susceptibility, you can have either salicylate sensitivity or phenol sensitivity. And with phenols occur a lot in artificial foods, like artificial coloring, artificial flavors, and artificial sweeteners. So Dr. Feingold, an allergist pediatrician previously at Kaiser many years ago, did studies on the Feingold diet. And he was noticing an observation, particularly between red food dyes and symptoms of hyperactivity. So he developed the Feingold diet to eliminate excessive phenols and salicylates from the diet. It's not, preliminary studies looked really valuable for ADHD. Subsequent studies have not shown to be as effective as it was initially hoped. But what came out of that for sure is we know that in a certain subgroup of children who are susceptible for any of a number of reasons, if you give them red food dyes, they can have immediate red flushing of the face and of their ears and get extremely hyperactive and impulsive for the duration that red food dye is affecting them. So one simple thing that can be done with the diet is to eliminate artificial red food dyes. Now, natural red pigment in healthy fruits and vegetables can have lots of antioxidants. We're not talking about natural pigment. We're talking about the other artificial coloring. And depending on if there's really a lot of there's natural salicylates in foods, and salicylate, of course, is the main chemical compound in aspirin. American Academy of Pediatrics a long time ago realized it's not beneficial, except for very specific serious medical diseases, for children under the age of 12 to have aspirin. Aspirin given after influenza in young children can trigger a life-threatening disease called Reye's syndrome. And that's why there was a switch over time to ibuprofen and acetaminophen for fever and pain management. So one thing, of course, is to avoid salicylates, especially in young children. And then if there's definite salicylate sensitivity, you can't eliminate all salicylates from phenols in foods. They're in so many foods, but at least there are some diets that are relatively lower in phenols and salicylates, like the Feingold diet, if there's a strong suspicion, maybe with the guidance of a dietitian, that there is that kind of sensitivity. There's no direct way to test it other than with a phenol challenge or salicylate challenge, which that should be done in a medical office, very carefully monitored. So I hope that helps. It's a complex issue.
It is a very complex issue, and I so appreciate you giving us all that information. And so the second part of this question is about how can we tell if a supplement reaction is due to something working like die-off or incompatibility like allergies, especially with yeast. I know at one point we realized that my son was a candidate since he wanted to only eat bread and potatoes. We wanted to.
Right, that'll feed the yeast.
Yeah, that'll feed the yeast. And so we decided that we wanted to take that out, and things got worse before they got better. And I was sitting there saying, well, this isn't working. I want to go back to the potatoes. And somebody finally said to me, you might be experiencing die-off. So how, and and they explained to me about how yeast is a living organism, and that when it's, dying, when it isn't being fed, it grows a little bit bigger trying to get what it needs. So things could get worse before they get better. But how do you know as a parent? You give a supplement, like what do you recommend as a pediatrician? How long should we be trying a supplement or a medicine that's being written, prescribed by a doctor? How long do we give something like that before we say, this isn't working, and give up on it?
That's a very complex question, and I don't think science has a true answer. We can't give you hard and fast guidelines. So there's, to some extent, there's some trial and error. And then you have to balance what you're doing. You want to look at the potential benefits and drawbacks or side effects of anything that you're doing, and combine it with some behavioral observation data as well. Because if there's some worsening, if the symptoms are mainly behavioral that are worsening, you want to make sure that, if there are other factors totally apart from diet or supplements that may be implicated in the behavior as well. If the symptoms are mainly GI, then I think it's more clearly likely to be related to either the yeast overgrowth, or if you're treating the yeast overgrowth, potentially some die-off. So as the yeast cells, if there's excessive yeast in the intestines, and then you're doing a modification like a dietary measure to try and decrease the yeast. As the yeast die off, some of those products may leak into the bloodstream. That's the thinking, but there's no direct medical test that you can do for that. To check for yeast overgrowth in the first place, there are some tests that could be done. Certain labs will do stool culture for yeast, and then you can combine that with a blood test for yeast sensitivity that would look at an antibody called an IgG antibody. And there are some lab tests that can do that can help guide. But a lot of this is kind of carefully following the symptoms over time. And I think it's one area where we need more research. We don't have hard and fast answers. But I think if you're doing reasonable dietary modifications, no one needs a huge amount of white bread and starchy potatoes in their diets. So something reasonable like you tried, even though things temporarily seemed worse, I think knowing that die-off can exist can give you some hope to persevere through that and see what the long-term benefits are. And then if you combine that with some repeat laboratory measurements to see if those are improving. The thing is, the stool yeast culture test is a little bit difficult to interpret because we all do have yeast in our stool. So it may relate to the quantity of the yeast that is cultured. And one of the things that I hope to do at CARD, working with eminent scientists like Dr. Doreen Grenpichet and Dr. Dennis Dixon, is we have this powerful online skills program that lets us track behavioral data, and we can correlate that with discrete and duration events. We call them, like when you start a diet, if you're continuing on the diet, and then actually measure what is happening with the behavioral symptoms. And then we can look at not just one case, but thousands of cases, and try to deepen our knowledge so that we can answer those questions better.
Yeah, does that help? That helps a lot. And I just want to say, for any parent who's out there who's frustrated with this idea of, we say a lot, well, this needs more research. And I do want to point out that one of the things on the list that Katie Wright wrote to Autism Speaks this last year and said, these are the things that need more research on, that parents of kids with autism want. One of the big things was yeast and yeast reactions. But I think what you're saying, Dr. Copeland, is so right on the money, that we haven't been able to take a big enough sample of kids who've had this kind of a supplement or this kind of a diet and what reaction they ended up having over it. And skills is one way that can happen. That if every parent who's using those kinds of intervention went on skills and put it on their timeline and said, and this is when we started this supplement, and then we see clearly the change in behavior, we could turn this around and help more kids. So really, I love that you brought that up. I want to move on to another question that somebody wrote in about. They said, Dr. Copeland, are there natural remedies or methods to help asthma. During PE, running, and the neighborhood has horses that he is allergic to, their son, can trigger his asthma. If he takes his medication, he can get spacey and can start making verbal sounds uncontrollably. He's 13 years old and tries hard to keep his verbal tics under control. He's exhausted from having to control his vocal tics, and they said, thank you so much. It's a really interesting question because for an autism parent, you know, you're trying to work on autism symptoms, then you have something that is, you know, clearly a medical, you've got asthma going on, and when the prescription for that is something that makes the child with autism spacey, you feel like you're between a rock and a hard place. So what can you tell us?
Well, I'd be very careful with that because asthma is a treatable condition, but it can quickly become life-threatening in an otherwise healthy individual, even a young individual. And, you know, I'm trained both as a medical doctor, and I have to live up to what's called a standard of care of practice, and I try to use evidence-based practice as much as possible. I also try to practice in what's called an integrative approach. So integrating in where it makes sense to integrate in natural treatments with what we know scientifically works. So there's a variety of different kinds of asthma medications. And the two basic types, there's kind of rescue treatment and then what we call maintenance treatment. And there's a variety of different medications for the rescue treatment and for the maintenance treatment. So if the family thinks the child's clearly having some side effects, it's not always clear whether that spaciness is really from the asthma medication or from the allergy that's triggering the asthma in the first place, and then they don't feel well. That may be the real cause of the spaciness, not the asthma medication. So you don't want to move away from perfectly good and effective asthma medications for what can be potentially such a serious condition. I think it would warrant an appointment with the child's general primary care doctor to really just go over the treatment plan, the asthma treatment plan in more detail and really understand all the medications and the choices, while also employing as much as you can of natural triggers. You might want to get a special air filter for the house, one of the HEPA filters that, and especially use it in his bedroom. Look at the prevailing in winds, and if the winds are blowing the horse dander from the nearby horse farm, that may be a time to get that HEPA filter out and have him in his room more where he has less exposure. If there's any known triggers, you want to try to avoid those triggers. So the animal dander from the horse seems to have been identified, but are there other triggers? Is he sensitive to other animal dander from cats or dogs? Is he sensitive to dust and dust mites, trees and their pollens, grasses in the area? So that should all be coordinated with the primary care physician, and if need be, a referral to an allergist or pulmonologist who's an asthma specialist to see if further allergy testing needs to be done to better be able to avoid triggers. Certainly stay away from cigarette smoke because we know that that is often a trigger for asthma. And then check to see if there's any food sensitivities. It's only in about 5 to 10% of individuals with asthma, but getting back to that leaky gut and the salicylates we were just talking about, for some individuals with asthma, salicylates can be a trigger. So the excessive salicylates in food. And there again, you might want to consider a special diet that you don't want it totally restricted in salicylates because that's too severe a restriction. But something like the Feingold diet and the low phenol salicylate protocol that the certified nutrition consultant Julie Matthews talks about can be helpful. With regard to the rescue medications, those are critical. They can be life-saving if there's really bad wheezing. And they're more likely actually to cause hyperactivity and not spaciness, although maybe the spaciness is distractibility, I don't know. They're bronchodilators, medications like albuterol, and we know they're very, very effective and can be life-saving. For the maintenance medications, they're a form of inhaled steroid, and a lot of parents get very afraid of steroids, and they don't realize there's good long-term evidence that inhaled steroids don't get absorbed that much systemically. They don't have a lot of systemic side effects, and they can really help heal the lungs and make the airways less sensitive to the triggers in the environment. So there's lots of things to think about.
Okay, great. I'm going to move on to another question here that came in via email. Are there any risks in trying methyl B12 shots with my 7-year-old son?
Okay, that's a great question. There's a considerable interest in the medical field in methyl B12 vitamin injections. It's given as a subcutaneous injection. And this is something that DAN doctors and medical doctors who've graduated from the Medical Academy of Pediatric Special Needs have had a strong interest in and have been advocating for quite some time. And there's a lot of reasons to continue research in this area. We need more definitive answers, but it's a water-soluble vitamin, and it's generally pretty well tolerated. And there's lots of scientific reasons to consider possibly using it in autism. It is very important in folate metabolism, the folate cycle, which occurs naturally in our body. Folate is another B vitamin. And the folate cycle is very important in an amino acid cycle that starts with amino acid methionine and goes on to another amino acid, homocysteine, and that cycles back and forth. But from homocysteine, we actually produce glutathione, and glutathione is a very important part of our antioxidant system. And there's growing evidence, such as from the research with Jill James, a doctorate nutritionist, of oxidative stress in children with autism spectrum disorders, and that dietary manipulations and supplementations can improve the oxidative stress level. So I want to cite one study in particular. It was not totally a positive study, but it did offer some hope. And it was done by Bertoglio and colleagues at the UC Davis Mind Institute, where I live in Sacramento. And it was published in 2010 in the Journal of Alternative Complementary Medicine. And what they did was a double-blind, placebo-controlled trial. There was 2 phases. The first phase was double-blind. That was a 12-week study of subjects versus controls, where the subjects got the subcutaneous methyl B12, and the controls got a placebo. And then they did a crossover. And then after the 12 weeks ended, they did allow families to continue the study extended in an open-label trial. They were hoping for more success than they got, but overall, there was no statistically significant mean differences in behavior status or in glutathione status for either the methyl B12 or the control subjects. However, there were 9 subjects with ASD who had this dramatic improvement shown on the Clinical Global Impression Scale and at least 2 other behavioral measures. And those children who improved also improved their reduced glutathione status. And it's the reduced form that's most important for being able to combat oxidative stress. So the thinking now is there may be a certain subgroup of individuals with autism spectrum disorder who do significantly benefit from methyl B12. But right now we don't totally know how to predict who those are. So I would say consider it, discuss it with your primary care doctor and maybe with a specialist like myself or another doctor such as a MAPS graduate who specializes in this area.
Wonderful. We're running out of time, so I'm going to sneak some questions in here. How can you find out if your child has pandas? I asked my daughter's pediatrician, and she had never heard of it.
Okay, PANDAS stands for pediatric autoimmune neuropsychiatric disorders associated with strep.
Okay, so for people to know, we're not talking about the cute little bears, right? This is a very serious thing.
Disorder. Now, there had been speculation a while ago that pandas might cause autism or aggravate that. That's never been proven. It's a theory, it's a hypothesis, it's interesting. But what pandas is known to cause is a pretty serious, sometimes, tic disorder, a movement disorder with tics, not just motor stereotypies, or repetitive motor mannerisms seen in autism, but kind of short, sudden motor tics associated with severe anxiety and obsessive compulsive disorder. And it's not conclusive that most children with autism spectrum who have repetitive behaviors have obsessive compulsive disorder. To have obsessive compulsive disorder, you have to recognize that your repeated habits make no sense. You don't like to do them, but you feel compelled to do them because otherwise you're super anxious. So really, pandas, we know it can cause motor tics and obsessive compulsive disorder, and it's treated like you would treat tics and obsessive compulsive disorder in child psychiatry. You use like selective serotonin reuptake inhibitors or SSRI medications. SSRI medications have not been found to be, particularly helpful overall in a large group of children with autism spectrum disorder. They may have a particular indication with one specific child with autism who has anxiety.
Okay. I've got time for one more question here that has to do with obsessive compulsive disorder. My son has rituals like needing to touch things a number of times and only eating food if there is an extra thing of the same food, so he can always leave one of anything behind. Is this part of his high-functioning autism, or could it be obsessive compulsive disorder?
I think it's much more likely to be part of the high-functioning autism. As I mentioned earlier, you can't really diagnose obsessive-compulsive disorder unless the person has insight into their compulsions. They know the compulsions don't make any sense. They don't want to do them, but they feel compelled to do them to reduce anxiety. Many, many children with autism spectrum disorders insist on their rituals and enjoy their rituals and have no insight into their rituals. It's just something they strongly repeat over and over again and get insistent on it. But even though I think it's more likely to be part of the high-functioning autism, it's still treatable. It doesn't mean that it has to be accepted, this is just part of the autism. It's a behavior, and as such, it can respond to scientific techniques with applied behavior analysis. So I would work with your child's ABA team on treating that.
Okay. We thank you so much for being here. We have plans to see you again. I believe it's on November 18th. I'm not sure of that date. It's the third Tuesday of November.
I'm looking forward to it.
I'm looking forward to it too. And you guys can be writing in questions from now until then. And we there were questions we didn't get to, and I apologize today, but we'll save them for November and we'll just add to the cache. So, but we thank you so much for being with us, Dr. Copeland.
Thank you, and thank everyone.
And if people would like information about how they can reach out to you if they want to become a patient of yours, where should they go?
They should contact the West Sacramento Card office at 916-374-0800 and ask for our office manager, Rachel Bittner. She's my medical office manager, and her extension, I hope it's okay I give it out, is 1561.
Okay.
So she would be the contact person.
Okay. And so that's for people who are in West Sacramento area. But if people want to consult with you, they can do that if they're within the state of California. Is that correct?
That's correct. I'm licensed throughout the state of California. So what Rachel is doing, we're getting a cluster of groups of families and children in different locations in California. And if there are enough children and families that want to see me, then I can travel to those sites.
Okay, awesome. So be in touch with that office, that number. And thank you so much, Dr. Copeland, for being with us.
Thank you.